At Mater, all our nurses and midwives in particular do all their clinical practice with us. So that can be 3 or 4 years that they're here. They're not transient visitors that are just coming in for a block placement and off they go. They do all their placement with us. So we have a real vested interest in making sure that they're as clinically competent and as confident as they can be when they graduate. We asked Health Workforce Australia to support us with the funding to build a structured simulation centre for that purpose.
MEPIC is really quite a unique area in the fact that it is a clinical area. So this area here used to be the nursery of the Mater Mothers Hospital. So with the HWA funding, we were able to take what was a clinical attribute and convert it to make it useful for educational purposes. But ours takes it to that next level because suddenly they're not just working with our mannequins, but they're managing an entire case. And they have to work not just with our mum and her support person, but they also have to work with the team of clinicians who are managing the case. So from that they learn lots of different skills that they've never had the opportunity to rehearse, and often those skills don't come into question until a real emergency hits. It's very hard to respond in an emergency if you've never had the experience before. So one of the scenarios that we run in our MEM course is a difficult birth, a birth that's complicated by what's known as shoulder dystocia. When you actually see it happening at a birth, it is really quite frightening. We can allow students the opportunity to review their knowledge. They can practice the various manoeuvres because there's a stepwise process to manage this case. Then they can come and have an immersive scenario as a group, as a team, look at what else needs to be done, making sure that you've got the staff there who you need, making sure mum's well supported, and making sure that baby comes out in the best condition possible.
It's full every day. Every single clinical practice unit across the adults, women's and children's service are using it. All the interprofessional groups are using it. None of that was really anticipated. So often you get financial support to build something for a specific purpose, but the health services and the health industry will embrace it, and then you'll find so many other benefits spinning off from that for the clinicians, their clinical training, and of course the whole purpose of simulation is for clinicians to be able to provide safe care to the patients and get the best possible outcomes for the patients. Although that's our ultimate goal, sometimes that's not foremost in your mind when you're applying for this funding, but that's actually how it's played out in real life for us.